I was playing basketball one day with some friends and I ruptured my Achilles. Probably the worst day of my life, to be honest with you. When I was with my friends, his wife was a physician and his brother-in-law was an orthopedic surgeon. So he told me to come to OrthoVirginia. I went to OrthoVirginia. They scheduled me with Dr. White and got surgery a few days later. And then one of my friends actually, he ruptured his Achilles too, go figure. And he recommended Amanda because I didn't know what to do. I was like, who did you go to? Let me know. And he was like, Amanda's the best. He really raved about Amanda. He was like, she got me healthy. He ruptured both his Achilles, left and right. So I was like, all right, well, if you've been to her twice, that's saying something. So, but no, Amanda's cool. She's been, honestly, I didn't really know what to expect. But you know, she's very hands-on and friendly and she really listens to you. And I think that was the biggest thing for me. So she really did listen to like, you know, my needs or like how I'm feeling. And she was like, okay, maybe we'll go a little lighter today or we'll go a little harder. She doesn't really take it easy on you, but she does listen. So I think that was really one of the key things that I like most about Amanda.
Yes. So typically, of course, this depends on physician to physician, but I believe you came to me around 4 weeks after your surgery.
Yes. Yep.
And typically they try to come either the same day or the day after that they get the cast off. Because from there, so they're in the cast and they're in that kind of pointed foot position. So they haven't had their foot on the ground since the day of the injury. And so they typically come in that nice tall boot. And especially with the Achilles, trying to promote that continued healing, that there are some little lifts that keep the foot still in that pointed position for a few weeks. And then we gradually peel it out as both the time allows, healing continues, and motion progresses. And so, Terrence, you were in the boot for about, I think, probably about 11 to 12 weeks. Mm-hmm. Once we kind of got all the lifts away, we were working on motion. And kind of each week we're looking at, okay, how are you feeling? How is even something as simple as how's the incision healing? You know, making sure that aspect is going well. And in those initial phases too, we're working on that, both the confidence in being able to put your foot on the ground in the boot, as well as looking at the rest of the chain, you know, making sure that the other muscles surrounding are waking up in addition to the calf and the Achilles complex. And so kind of from getting out of the boot, that's kind of where the fun begins, I would say.
We'll call it that. You know what's funny? The first day I met you, when you did the exam, you told me to walk. And I gave you this crazy look. You couldn't see because I had a mask on. I gave you this look like, this woman's crazy. And you made me do the stairs. And I was struggling. And I was like, what have I got myself into? Because you made me, I was like, what? I'm walking already. Nice. But it worked out. It worked out well.
Yes. You know? And so, and especially in those initial stages of physical therapy, it's of course really important to be able to establish what patients, clients have to be able to do at home. So something is, while it was scary, but those simple things of having to, if you have a second floor bedroom or if you have a couple stairs to get in your house, building that confidence, making sure that is safe and controlled. And then even too, when you came out of the boot, sometimes that's a little scary too.
Yeah, I had my moments. I still do after a year later. It takes me like 15 seconds, but I'll do it. You know, that little mental wall. She's really good at kind of pushing you, like not too hard, but not too much. Like, okay, you got this, kind of like the nudge out the nest. But like a little mama bird, but like, you know, I trust you. I've been teaching you well. Go ahead, do it. You got it.
Fly.
I won't let you fall. You know, yeah. So she's really good about that. I guess you could say yes. For some people, I know she kept saying, you know, some people heal quicker than others. So I kind of had an estimate, but I didn't know how long it possibly would actually be because, you know, she was telling me some people heal faster, some people heal a little slower. So I kind of had like a ballpark range, but I didn't really know how long it could possibly take. So I guess I'm coming towards my end. We're supposed to be testing soon. So, you know, it's not you, it's me. We gotta break this up.
I've heard that before.
So, yeah, you know, I'm looking forward to, I guess, living a normal life again. So, yeah, it's been cool so far. I'm gonna miss the deep tissue massages though. It's really good.
Absolutely.
I'm able to, but do I want to? I think hoop dreams is gone. At least for now. I'm still nervous because when I did it, it was just something simple as a pivot. So that's still in the back of my mind right now. I think I have to get over that mental hump. Will I play again? I don't know. Right now, in my mindset, it's in the back burner. Not within the next few months, put it that way. I don't know. Maybe in the future, maybe. But right now, I'll just shoot around and kind of be like that old guy in the gym, just shooting around. I don't want to play.
But you have been, I will say, as you've progressed in your physical therapy journey, we have been able to implement things with both, of course, with footwork, getting back to running, especially. Every patient, every client has different goals. So kind of, we kind of going back to what you said, yes, some people leave physical therapy sooner, but they may not have the same goals, meaning they may not have goals of wanting to get back to running, wanting to get back to higher level, especially cutting sports. So some people may finish physical therapy earlier, that maybe their goals are still getting back to the gym, getting back to walking, getting back to life, of course. But especially with what you want to do, it's been a little bit longer to tailor what you want to get back to doing. We've been really emphasizing making sure that your running gait is beneficial and biomechanically stable for you, and it really has progressed. Your speed has progressed, as well as we've been, of course, incorporating some good, fun jumping aspects. I still have confidence that you'd get back to basketball. Maybe one day you and Dr. White can have a little test. We'll see. But we have been implementing different drills with the basketball. So we've been doing some footwork drills, some jumping drills with adding a basketball, not letting you look at your feet. So having to get that hand-eye coordination back, that change in direction, that pivoting ability. So I think if we maybe converted our clinic and had a basketball hoop, I think you would be able to get back.
No, for sure. Easy. I would say my confidence has definitely grown. A fast jog, I guess you could say. I'm not like full out sprint, but I'm doing pretty good. And
you've sprinted a couple times as well outside of the clinic.
Yes. And I did a couple squats on the squat rack. Yeah. Form isn't the best, but no. She's definitely really increased my confidence on some things I can do. I think it's just a little bit now, it's just on me. But yeah, Amanda's really good. She's definitely increase my confidence on jumping, sprinting. Like I said, sometimes I give her a crazy look. She'd be like, okay, we're going to do this today. I'm like, just under my mask, I'm just like giving her the grill. Like,